We really advocate for an early diagnosis because there are a lot of things that you can have a say in early on in this disease. You can decide about how you'd like your care to look as the disease progresses. You can decide if you want to move closer to your kids and where they might live. You can decide if you want to take that big trip that you've been putting off. But more importantly, it also leaves you more eligible for if there are any clinical trials in your area. A lot of times that has to happen early on in the disease process. Again, just really knowing where you are health-wise, making changes where you're able, maintaining a healthy weight, again, eating healthy, getting good sleep, and staying active both cognitively and physically, really, we believe, can go a long way in preventing the cognitive decline. Just last year, there was a new study released that talked about the importance of maintaining a healthy blood pressure. 120/80 is really the critical number where if you stayed at that level, you saw a decrease in the risk for cognitive decline. The only way we're going to break down that stigma is if people learn that this is a disease, just like any other brain disease that you might have, that deserves being talked about, and so that we can address it. And I think that that also will help eradicate some of the isolation that goes with the disease, with caregivers and with the people living with, staying shut up in their homes and not really getting out. We see 40% of people who are caregiving actually die before the person living with Alzheimer's disease because so often that takes a toll on their own personal health. So, making sure they're keeping up to date on doctor's visits, but even getting out to be with friends, doing what they love most, if it's a day at the spa or getting your nails done or even coffee with a friend can really make a big difference. And it can also allow them to come back with fresh eyes and be able to begin that caregiving role once again.